Can we have the slide, please? So, thank you, sir. It is an absolute honor and pleasure and a great opportunity for me to introduce SRS, sir. As we all know, the name S. Raja Sabapathy resonates with us in the plastic surgery fraternity very well. We have a lot of love, affection, admiration for him, and it is very nice that I have had this opportunity to talk about him. So just 2 days back I was at Hyderabad for exams, and you know those wicked kind of examiners who like to ask those difficult questions. So I am one of those. And I was thinking about some typical difficult questions which I would want to ask. And at that point of time, sir called me and said that you have to introduce SRS sir. And it was like an instant karma, the roles were reversed. The difficult question came to me, the difficult job came to me. And then all the students ended up with easier questions. So here I am. So I just want to say that these are just some of the few of the notable achievements which SRS sir has sort of gathered over the years, but I am not here to talk about them. I will try to talk about the aspects of SRS sir which are not mentioned over here. So way back in 1978, he and his family, his brother, his dad started with a Ganga nursing home in 1978 with around 15 to 17 beds, and now it has evolved to more than 650 beds, and it is one of the apex institutes of ortho, trauma and plastic surgery in this part of the globe. But I think that is not a big achievement. Anybody can build a big hospital. What is important is that he has developed a legacy. Over the years, he has built up a fascinating team, and each of his team members, each of his associates is a giant in the field of plastic surgery. So I think that is one of the fantastic achievements. Every graduate or postgraduate passing from India, we tend to think of going abroad and working at apex institutes in the Western world. But what he and his team has done is that they have reversed the scenario. Now we have people coming from all across the globe to Ganga Hospital. So over the past 15-20 years, I believe more than 3,500 people by people I mean surgeons, orthopedicians, plastic surgeons, hand surgeons from more than 80 countries have visited Ganga Hospital. And it is a matter of pride for us that we are associated in some or the other way with Ganga Hospital. I believe not a single plastic surgeon from India, there is not a single plastic surgeon in India who has not visited Ganga Hospital, not spent a couple of days, weeks over there and learned from what they have to share. So he has established a center of excellence, I would say, innovation as well at Ganga Hospital. Apart from that, as plastic surgeons, our goal is to treat our patients, cure them, rehabilitate them. But I think at Ganga, even sir talked about it, they have a different level of dedication. I believe they operate patients, we all operate patients, we try to get them back to function, they also try to get them back to function. But even after that, they give jobs to those patients in their hospitals. So I think that is perhaps the most meaningful of the rehabilitations that one can possibly do, to have a holistic approach and get them into the mainstream of the society. Apart from this, I think there are so many contributions which he has, but one of the most important and interesting contributions I feel from a plastic surgeon's point of view is that during his presidency he started the Plastic Surgery Day. Now many of the general public is not aware of what plastic surgeons do. They tend to equate it to cosmetic surgery, rhinoplasties and all those things. But apart from that, there are so many things that a plastic surgeon does. And starting this Plastic Surgery Day gave us all plastic surgeons an opportunity to share with the general public as to what type of surgeries we do. Apart from that, on that particular day, there are free surgeries conducted across India by many plastic surgeons to celebrate the day, to let the people know of what plastic surgery is. And then finally, after a couple of years, now the world has accepted it. It started off as Indian Plastic Surgery Day. Now it is celebrated across the globe as World Plastic Surgery Day. So I think that is one of the most phenomenal achievements that he has done. taking India onto the world map, not just in academics but also in advocacy as well. Apart from that, he has recently taken over as the first Indian as the president of the International Federation of the Societies of Surgery of the Hand very recently last week in Washington, and that is also a matter of great prestige and privilege for us to be associated with him. Finally, I would like to say that all these awards, achievements are just a part of the scenario. What is more important is the people who he has motivated and inspired throughout his journey, like me, people like me who have been inspired to do some amount of good work in whatever fields we choose to. So I think I can go on and on, but we are here to listen to him. So I think I will conclude my short introduction of SRS sir, and may I welcome sir to deliver.
National Burn Center, and ladies and gentlemen, it's also nice to have many of my colleagues, and some of them have given this oration earlier. So it's always nice to come back to NBC and to meet old friends. We have been, our center has been greatly inspired by based on this, and I should thank Sunil for all the help they have done. Not only for the help they have done in setting up the skin bank, but also for the periodical audit day, so which again it keeps us on track, and we really value it so much. So this talk on Founders Oration, I am very happy to give. I asked Sunil what I have to speak, and this topic was chosen by Sunil. And I think it's particularly very apt because NBC is a very iconic institution for India. And if we have very iconic institutions, that means there must be founders who have been extremely passionate about and work really, really hard. So, and it's also very difficult to sustain iconic institutions. I should really congratulate Sunil and also wish Siddharth to continue the legacy his grandfather and father has done. And while preparing for this version, I reread the article written about Dr.S by Dr. This appeared in the Indian Journal of Plastic Surgery, and I would urge every plastic surgeon to read it again. I read it at the time when this issue was put in, and the Indian Journal of Plastic Surgery has got a system of icon of the issue. So Dr. Keshwani was featured as the icon of the issue in one of the issues of 2010, and it makes wonderful reading. And one of the important things that I learned again was that for some part of the time the family has spent almost near Coimbatore, Salem, where I was born, and which is my wife's place too. And last night I heard that the great relationship with Erode in Salem, which is almost a part of the western of where from where I also come from. So it's the right topic for the final. And pursuit of excellence means, I think, to me, I think what it means is that maintaining the highest standards and continuously seeking improvement in any endeavor, whether it's personal, professional, or organizational. But more than important is doing something, I think it's the process that counts. I think what small habits that you want. You take greatness in every small thing, that you really have to take care. I think that's what in this 30 minutes talk, I'm not going to talk any theory. I am just going to tell certain incidences which I have felt, which I have experienced, which is really not very extremely good. Then I go back to 1983. I was a postgraduate in Stanley Medical College, working under Professor Venkateswamy. And at that time, Professor Venkateswamy was given a Pandale Oration. It's one of the prestigious Oration Association of Plastic Surgeons in India. Every ASI meeting starts with the Pandale Oration. I think the first feature of it is the Pandale Oration, 8 o'clock it starts. And Professor Venkateswamy was asked to give the Pandale Oration. Normally at those times, I think many of the senior people might know, we are not digital at that time. Having the Kodak aerosols, that is the thing of which we all used to go. And normally the projectors used to be longitudinal projectors. Somebody was using this Kodak projector, that means they are a bit higher. So there are usually used to have double projection was the in thing. I think that means they are doing it very well. So, but then what Venkateswamy wanted to do was, he wanted to do 6 projections at the same time. So I think what the 6 projects he pitched to is one. He must have a lot of stuff to present 6 projects. I think that's the first one. And secondly, he must be undaunted by the logistics of doing it. I think all 6 must go at the right time over there. But then Venkateswamy is a very tough taskmaster. So he had all of us, each of us were assigned one slot. Each of us like a monkey, now we have to sit near the projector. All of us had a script. That means all of us must know which slide goes up where. And we must also have a coherence of what other things are going. So that now you slip away, so you don't slip away. We rehearsed it so many times, I could have given the oration. I could have given the oration. I just told sir, I can even myself give the oration, sir. The last day, Professor R.V. called me and said, Sabapathy, you please go to Taj. We are rehearsed it very well here. I think we need to rehearse in the venue. Oh my God, I thought those days, you didn't have mobile phones and all this. You go late to the house, you can't even tell your wife you are late. My son had just been born. And sometimes he used to be sick and all that. So anyhow, I went to the Taj. The first experience was I went in a Vijay super scooter. That fellow stopped me, the security stopped me before entering and he said, scooters are not going. Nothing, I had a small argument there. And then after that, I went to meet the manager. And the bunker manager said, it can't be done. Then I said, Venkateswamy has told I should never accept no as an answer. So I said, I have to meet the general manager. So I met the general manager. I said, the chief said me, he said, who is chief? So that's the way it started. And then, but I told him so much about the hand surgery and all that. But then he said, I really love to do it for you. But then what happened is that we have a North Indian wedding the previous evening. And they usually have the wedding late and they dance till about midnight. And then your hall is available only from 1 a.m. So I'm very sorry I can't do it. But inwardly I felt very happy. Because I thought Professor has rehearsed it so many times now, so I don't think you need to rehearse it. So I was very happy. I went to Professor Venkateswamy and then told him, sir, there's a North Indian wedding, sir. They will keep dancing till midnight, so we won't be able to rehearse. So he kept quiet for a minute and then said, Sabapathy and shall you all assemble at Taj at 1 a.m. I got a shock of my life. He said, please inform everybody and see that all of you are there at 1 a.m. So I think we are all at 1 a.m. there. And then we rehearsed it. And in between the projector, he also had a 16mm projection of wraparound snap. So I felt so happy that we went because the way it was organized, the projector was hitting the ceiling. So had we not gone that day, I think that time, I think we would have really lost a big thing. So I think that it all happened. So as usual, as expected, now it was a masterpiece. So, but then the worst thing I felt was the final rehearsal was, you see, that the ASA president, thanking him, he said, such a masterpiece oration delivered very effortlessly. They said, just like cricket commentators say, effortless delivery, masterpiece oration. So myself, Dala, all looked at each other and said, what's the amount of effort? So I think we really have to reach excellence. So one of the first criteria that I learned that there was, you need to take a lot of effort. It begins, a lot of effort is required. And this is basically it's an attitude. I think it's an attitude, not necessarily it has to be held by the head of the institutions or very senior people. It can happen anybody anywhere. Now we go to another instance. 1998, we started our work after coming back abroad in 1991. We were a small hospital. But at that time, still a lot of visitors used to come to our place. So in 1988, two doctors, I think many assistants will know. Prabhat Shivaso and Sanjeev Singh, they came together. Each were different characters, but then they mutually did a very nice, they had a great time with us. While I was coming for a surgery, I think Prabhat came to me and said, sir, I can't believe it, I just can't believe it. He was keep on telling, I just can't believe it. He said, what's it, Prabhat? You can't believe it. He said, sir, the nurse who is waiting for you to wait for your case, I see her crying beneath her mask. I said, why crying beneath her? I think the reason was she was standing there, scrubbed, waiting for me to come, but she was crying beneath the mask. That's because it was a case of a failed implant. It was a case of a failed finger implant. Of course, the finger was so rare those days. Jessie, the staff nurse, was, so what she was saying was that the replant she has assisted in the treatment has failed. I think she felt so much about it. I think she did not blame me, she had taken the ownership of the system. I think she has the ownership of the patient, she has set a standard for herself, that is, if you do a replant, it has to succeed. I think that's what the stand she has taken, and then she has made so much, and she was, crying me. I said, he was asking, how is that people could really think of it. So that means, it's not a question that the setting up standards, setting up quest for excellence is a higher level. I think anybody at any level, can really do this. So now we go to the 1980s. I think few institutions, we hold as a very dear to our heart, which I hold as a role model. One is the Mayo Clinic is one, because we really go to the history. They do it extremely well. That is Arvind Hospital. I think both of it I would like to talk with the Mayo Clinic in Rochester, which I very much looked up. It was also formed by two brothers, William and Charles Mayo. And when the elder of the two brothers said, the motto of the Mayo Clinic is the interest of the patient is the only interest makers. I think that's a very fantastic statement. I think in our hospital also, our administration is very lean and thin, because many people ask me how much of time you spend in the administration. I said I'm very actively involved. But I think it's fairly simple. I just ask one question. Any decisions that we take, we just ask that question. Does it help patient care? If the answer is yes, do. If the answer is no, don't do. I think that's the only message. That's the only way we decide. So I think that's what now we decide. So how did this all come up? And then you really go to Mayo. I think the hardcore Mayo people are really Mayo bound. I think they do. This is one of the books I would suggest anyone to read. The management research from the Mayo Clinic. So I have read it about 10 times. So in one of the chapters, in the orchestrating the use of quality, it says it may be difficult to read. So it talks about a lady named Mary Ann Murray. She is now a quality control manager in Mayo. I think when she was very young and she was just joined as an intern, she was running up to actually going to her office. So one of the senior persons stop her and then say, you've got dirty shoelaces. You can't have dirty shoelaces. It's not Mayo. But then to this, the young girl says, I work in the back office, I work in the, I'm not directly involved in patient care. But then he says, that doesn't matter, because when you wear the Mayo uniform, and then when you go in the corridor, or when you go before entering the hospital, so many people see you. And then you can't afford to have dirty shoelaces. And that's not Mayo. So that means it's you are trying to put in quality, you are trying to put in excellence in small things which reflect on the whole system. So that means. So this lady, the intern who argued, and then later on becomes a quality control inspector, and then she says that I should be able to, I really relate to this. So it's almost it's called as the girl with the lady, the girl with the dirty shoelaces. Okay, so I think this is what we need to have, and this pursuit of excellence is taking efforts to beat expectation all the time, each and every time, and every small thing fall and do. I think we need to really do it. So in 1990, I think this at that time I was a fellow in Louisville. I think Louisville in the United States was considered to be the mecca of hand and microsurgery at that time. The whole world was going down to Louisville. And they had a big legacy, because the whom they trained, all those trainees literally changed the world. I think if you take the president of the Asia Pacific Federation right now, he is Louisville. Past president myself was Louisville. The next fellow is also from Louisville. And most of the presidents of the various countries have all been Louisville. A generation of surgeons have been influenced by Harold Kleiner. So that's Harold Kleiner, and that's the time when I was doing with him. So they have a system of 3 people being on call. There's called first call, second call, third call. And the person who is first on call is the most important person. He has to receive the people in the emergency room, and then he has to talk to them, he has to decide, he has to get the consent and all. And then he has got the prerogative to operate. So the second on call is to assist. So the better the person, that fellow will be on the first on call. So I was the first on call, and Dr. Kleiner was the consultant. And those people, I mean, they stay in the house. Our client used to staying in the house. So I met a young lady who had a distal fingertip amputation. I think those of you non-medical, they are in the middle of the nail. I think the fingertip was amputated at the level of the middle of nail. So she had come for reattachment. But I thought this is so distal, I thought she would better be served by another small procedure in the fingertip. So I think that should also be functionally be adequate and all that. I talked to her, I can always talk nicely, I convinced her. She was also very happy. And then we were just about to do the surgery, and then at that time her old client came in and said, you always put your hand on the shoulder. He said, what you guys are doing here now, like the way he was drives, please you ask. And then my colleague Kevin Yakov was there, he said, well, they used to address him, I always used to give Dr. Klein, we from India always say Dr. Klein, sir, but they used to say Harold. So Harold, this lady has come from Virginia for a replant. I think Raja has nicely, correctly advocated to her, about advised her about a triangular therapy we are going to start. He just looked at me and then slowly he said, did you examine the amputated part? He asked. He said, no, because I had not decided to do it before, no. I didn't say, did you examine? I said, no. He said, why didn't you try? But basically we are good as surgeons, we are good fellows. So we just examined the amputated part, and then finally we started reattaching, and we successfully reattached. So towards the time when we were finishing, he came down and put his hand against my back. He said, he just put my back and said, those words still echo in my mind. Every time I make a decision, I think of it. He said, this young lady has flown all the way from Virginia, thinking that Harold will put it back. But then you fellows did not even try. Okay, so that's an amazing, it was like somebody hitting a broomstick on your head, So it is that. And then said, if I had not put them all back when I was your age, then you fellows will not be here now. I think that's a very profound statement. He said, so always try and do your best possible to help people. I think you must not think what's good for you. I think you have to think what does the patient want, and whether you are able to meet those expectations, and then if there's an extra effort is required, you are able to do that effort. So I think that was a great lesson that I learned today. I think that's the real quest for excellence, because it really helped me. But that was 1990, and then we stepped about 12 years later, and 2002 I had this patient in Ganga. So that is where all 5 fingers have been amputated in one hand. Okay, all 5 have amputated in one hand. Usually it takes about 3 to 4 hours to put each finger. So, and I was a single surgeon at that time. So of course I had all joined, but they are all very young. That's why I had to do preparation, both parts here, there, both sides I had to do. So 15 hours over after starting the surgery, 4 fingers have been put back. The last was the little finger. So till that time it has all been done under block. The block has been repeated twice. So when he came up with the little finger, still the hand was fine. He didn't have any pain, but was very good. But the patient was finding it very hard to lie down on the bed. So 15 hours lying back. He was feeling very uncomfortable. Then but said, anesthetist said, we need to give general anesthesia. Okay, then he asked me this quick question, sir, he said, sir, 4 fingers were fine, okay. How much do you think that the distal little finger will add for function? Because shall we stop here, or do you think we should give a general anesthesia? Because the whole room is in a stage, after 15 hours, God, you're all in the same. It is so easy to say yes now. Because everybody wants you to say yes. The nurse wants to say yes, surrounding fellow wants to say yes, and all that. But at the time, I really thought of Harold Klein. But if you really think, what will the patient think? You really want to have a little finger. No doubt, you really want to have a little finger. Then I told, but I agree, but given the choice, I think the patient will want a little finger back. Okay? So we are I also told him we are on the threshold of making history. To my knowledge, I thought, we never had anybody do all 5 fingers in one hand. So we had done 8, 4 in each, we had done 7, 4, 3, we had done. But then all 5 in one finger, one hand, I didn't remember anybody doing it. Then I said, but it's all right now, we just go for a couple of hours more. 15, I think it doesn't really matter now, repeat a few hours. And then what we did was, We did another 2 hours and then we finished off the little finger and that's it. With all the fingers back. Okay, so so I think what really matters when these people say is that of how many of you read this poem by Rudyard Kipling? So it's an amazing poem. Many times I used to read again and again. Okay, it will start off with the word if you are keeping your head and all about you or losing this and bringing it on you. And in one paragraph, it will come up which says, if you can force your heart, nerve and sinew, to serve your turn long after they are gone, so hold on when there is nothing in you except the will which says to them, hold on. I think you just have to carry on. So you just have to carry on. So at that time when you have that courage and that stamina, and then you have to say, okay, just let that pass. So I think that is really essential, and I would say that's absolutely important. The small things which you have back in your mind, the most important thing is you need to recollect them back, recall them back, and then say, agree to your mentor what they have taught you, what you have said. It's also important because not that it's talent. I think anybody sitting in the front row will do this, and we will do all the 5 fingers back. But then to have an opportunity to do the 5 fingers back is difficult because somebody must come here with the 5 fingers cut. And there is only one way, one angle where all the 5 fingers can be cut separately. Otherwise, if any angle it goes, you will find the 2 fingers will be either be joined together, the little finger will escape or the thumb will escape. So you can't. I think it's extremely difficult to get individually all fingers back. I think it's just the sort of thing that happens. And just last week, as I was coming back from Washington to Heathrow, I think this slide was there. It says, opportunity is knocking, it is just as a problem. So many times, a lot of us have opportunities. I think that's also an opportunity. But then it also has problems, it has also got challenges. But then at that time, what you have to do is that you need to understand that behind the problem, there's a big opportunity. And I think for that, if you have to do, that means somebody you must have worked under, who has been a living example for you, so that you feel it is worth following it on. So excellence comes out of having a good purpose. I think that's very important. And many of those people, I think this words, goals and a purpose, have a good goal, have a good purpose, we all repeatedly keep saying. But then many of us don't really understand what's a goal and what's a purpose. So suppose somebody asks you, what do you want to, I ask many an youngster, what do you want to be? Because everything, there's nothing to stop you, what do you want to be? Okay, then they say, I want to be the best hand surgeon, the best microsurgeon, or something like that, I want to buy a Mercedes, or anything you can say. But then they all know goals. They think, I want to be a best surgeon, I want to build a hospital and all that. But then that's not a purpose. But somebody wants says, I want to be the best congenital hand surgeon. But then that's a goal. But then if we say that, I say that every child born with a deformity will lead a normal life. That means that's a purpose. That means that goes beyond treating them. What if people can't afford? Then how will you provide good quality service? How will you give them proper education and equal opportunity to provide? So that means it's a purpose. But then if you have a real good purpose, but what will happen, and no doubt whatever happens when you stick down to your purpose, I think all your goals will be achieved on the way. I think they'll all be achieved much further, much easier. I think that's what it. So that's what he says, the goals are related to you and purpose is beyond you. I think that's very important. And it is extremely, you should be lucky if you are able to, someone has been able to make you understand the difference between a goal and a purpose. And early on in life or any time in life, you articulate your purpose. It's not that a feeling. I think you need to put it to pen to paper. And if you are able to articulate it, it's extremely good. And you will chase the purpose no matter what. I think that's very important. So I think we learned from Arvind Eye System, is one of my favorite institutions. I am extremely happy that Siddha's wife studied over there. And the purpose of Arvind Eye Care System is that they have preventing needless blindness. So that's an amazing statement, preventing needless blindness. Okay. So when we started in 91, I thought when I come from America, I'll be terribly busy. I was not too busy, no cases. So I used to attend any meeting. So somehow I think it's God's grace that I attended this meeting of ophthalmology where somebody was, Arvind was pressing, and Mr. Turasura is the executive director of Arvind Eye Care System. He was doing. Those of you who don't know about Arvind, they do about 500,000 surgeries a year, and 65% of them are free. Okay, and they are debt free, and they are expanding. Okay, and if you really see, they got an eye care, they manufacture lenses, and they hold about 18% of the world market. And they manufacture sutures, and they are 26% of the world market. I think it's really a great institution to do. And then when Mr. Turisraj was speaking, I just returned from the United States, struggling to find our feet. And then he was telling me in 1980, at the stage when Arvind started, I think only 8% of the cataract blind in India were getting operated. 92% of the cataract people in India were going blind. And because of the three reasons, one is that they are not aware of the possibility. And those people are aware, they do not know where to go. They know both, but then they do not know the finances to have. So these are the three things. And then what Arvind did was, it was not fighting for the 8% market. Most of the times, what surgeons we do is that we fight for the market. We just have to find out the underserved market to improve. I think that's what we do. And what they did was, for non-people aware, they educated. They are aware, but they do not know what to do. Then only in the guide they started doing camps. So then the last one, whether finances to go, then these things they subsidize or do it free. So that's how they started. So as I finished the talk, I went up to Turisraj. I asked him, sir, I just come back from the US, I'm a hand surgeon. Do you think it will be the same thing in the hand injuries also? I asked him. And because when he was projecting cataract, I was sitting in the hall and I was substituting hand injury, hand surgery for every word of cataract, I was just substituting. And then I went up to him and asked him, he said, just tell me, it will always be like that. In India, everything will be like that for me. So then I came back home and I said, told my wife, hey, we are okay, I think it will be alright. She asked me, what happened to you? Again, I told him, no, so now I know the path. That is, so immediately what I did, we had educated. So first thing I put the brochure. So this is the brochure which was done for that. And immediately after a month, and when this brochure, it made it very attractive. I made it attractive so that I also understood that when hand injuries happen, whether it is treated by Nango Hospital or by ASI or government, it is decided not by the patient, but by the labor officer, or the personal officer, or the management. So I thought I should make a brochure which is attractive enough so that the personal officer feels a little difficult to throw away. So I thought he must have it for at least some time to do. So I think that's how we started. So we also decided, I just copied. I think I don't have any shyness to in this word. They put preventing needless blindness. What we did was preventing needless deformity from hand injuries. And we just started about this. So we also served the underserved market. And they did involve a lot of hard work, but we are not in competition with anybody. I think the most important thing was we are not in competition with anybody. And I'll say now, 1994, because of this, because we had this idea, no matter what you need to do. I think that is the idea. No matter what you have to do. 1994, 3 years after coming, we were extremely busy. So suddenly we became very busy. And the day used to grueling work days. We used to start operating at 5 a.m. and used to operate till 9 p.m. And then after that, emergencies. Emergencies come also busy. So you're working like jolly bad guys. You are working. So and also it was very demanding a demand on the infrastructure. So every new patient who came, I think, was directly brought to the theatre. And because nobody to see downstairs, that's the only possibility. There's no other reason. So they just brought to the theatre and Buck used to see them. And he used to make a very difficult thing because there's a very small room. The pre-op patient will be waiting, some reference patient will be waiting, this fellow, new fellow will come and he will be shouting. So it made us it made us a very bad this thing. So what Buck thought was now, instead of opening the dressings, as soon as these fellows come, he'll give a block so that it becomes pain-free. So that's how that's how we started. So I think what it was, he just gave a block. So it really worked wonders. People are coming in pain for 200 miles and come to Ganga Hospital in 10 minutes on OP. I think that really worked wonders. So after some time,
What a few days after, and a few weeks passed by, we were giving it a lot of it, and it was going up very well. Then Bhatt told me, sir, I am extremely worried about the system, what we are doing. Those days, blocks were not very common. Blocks were not common in those days. He said, we give a block, then you open a dressing, and then tell that this is what will happen, this is what we have to do, this is the cost. And then what if, if he refuses surgery and then wants to go away to the hospital? So that means how can we send him off in a paralyzed hand? I think that's very bad because people do not know what has happened. So I think that's a very logical idea. I have not thought about it. But this is a question he raised. But I thought this is a great system. I think we should not leave it away. Then we are sitting around a coffee, we're just sitting in front of each other and taking a coffee. Then I said, these same words I used. I said, but we are the best in the business. If someone comes to Ganga and then he wants to go away, there can only be one reason. I think that's money. That means he cannot afford it. Then he said, no. Then we'll do it free or whatever he offers. I think for no matter of that, I don't want to lose this concept of this block and giving back. But then I can say that I operate it free, but he also has to do it free. So then I asked him, I told, but in that case, we do it free, are you okay with it? Then Bhatt said, sir, if you are okay, I am also okay. So then we said, I think the birth of the honorable block happened. I think the birth of the honorable block happened like that. And then we had very many occasions where we had to do it really. And then that's the way, but the spin-off of it was extraordinary. So we really became, the trust in the system increased. We had a lot of patients that we had. And then what really happened was we became now we are a center for regional anesthesia. In 2024, I think this is the statistics, 8,100 blocks have been given in our hospital. 8,100 blocks we are given. So every year 50 post-MD fellowships are there. 1 year 50 people we are taking. And for those 600 people apply. And then we find it extremely impossible to screen, and they were appointed an examining agency to conduct the exams. So exam. But I think if you really see how it all happened, it happened on that cup of coffee, just to decide, no matter what, you need to chase your purpose. But then it took a really lot of years to get it published. Don Leonard, who is the proponent of regional anesthesia, he visited us and then he saw Minister place and said, this is the best ever system that we had in the world. I think nowhere in the world you can have it. But then it is extremely difficult to duplicate, he said. It's extremely difficult to duplicate. But then he had it, and then he himself put it on. He asked me to write it. He sent to PRS. He said, I have to put it in PRS Go so that everybody reads it free. But then he said, you don't have to pay for it. Don't worry, we just might be. And in that, abstract I read, but then he wrote it again. He said, the honorary block was set up at Ganga Hospital, Coimbatore, India during the early 90s by the anesthesiologist Ravindra Bhatt and the plastician Raj out of necessity. But who recognized its value and made it the standard of care. So I think that's the way. So seemingly small things, but I think if you're really looking at the purpose as to what it is, I should really thank the talk by Dr.S from Ravindra on that day. But I really believed in what he said. But the most important thing is that you need to relentlessly chase the purpose no matter what. I think that's what leads you to it. Does achieving excellence relate to funding? I think that's the next question. Does it is it with money? Is it important? But I don't believe it. So you find, if you have a good idea, I think somewhere in nature conspires to help you. I think somehow it will happen. So I strongly believe in this. That is, in making major decisions, I think if you read money out of the equation, you make the right decision. The right decision gets you money. It got us money. I think we are not gone. We are in fact now we have grown. I think in every major decision that we make, we just devote the money aspect of it and then make the decision. And then relentlessly chase it, no matter what. I think do it and then after that we go. One of the things is that the Hope After Fire project where we do free surgery for post-burn deformities. However severe be the deformity, whatever be this thing, they can have. See, there's the right hand and the left hand of this young lady. So many confessions she has got. And this type of people, there's the left hand. So, and then the other one is the right hand. So after the surgery, they all become better. And not only that, she gets married and then we also give her a vacation to go back to work. So this might have required about 7 to 8 surgical procedures, but they're all 100% totally free from it. However difficult be the operation, we see if a guy can't walk, and then we put it, because we have an orthopedic setup, we do, we straighten him up, and he never walked for very many years. So getting him to walk and then getting him to physiotherapy itself is so difficult it takes. From that on, after a few weeks later, he goes to this stage, and after that, he goes to this stage, and now working the Madras airport is working now. So I think this is really. So I guess we have got so many stories to tell, and we have 877 patients we treated. The total project value is 12.15 crores. I think this is one of the single largest burn care projects to be done in, and then we operate free on it. The Rotary funds it for the consumables and the hospitals because we need to survive. But then the surgery and anesthesia is done free for that. So that means the total value for the project is high, and every rupee that the fund goes a long mile. I think that's what really happens. I think the next dream in progress is that we have conquered. I think now I say the post-burn reconstruction. I think it's done. I think we can do it for anybody in the country, anywhere in the world. We can do it free. We got enough of funding for it, and anytime we can do it, and we can do it at the time when they come. I think that is also fine. But the only thing what we are not still confident, I think Sunil also will be treating acute burns. I think it's a dream in progress for me. I think I'm sure one day I think we should be able to do it. I think one day I think we should be able to do it. The same thing what we repeated in trauma, and this thing we should be able to do it. So blessed are us, if you are having mentors who practice excellence. I think Bob Ackland is one person. I think all the plasticists will know about him. He is one of the persons who really made microsurgery possible. But those of you who say microsurgery does really miracles, I think what was thought to be impossible, I think we are already made possible. For example, if the total aversion of the scalp of this girl, I think we have been able to put it back, and there's the same girl, and then she comes back to us with a wedding invitation. We treated her when she was a small girl. I think now she comes back with a wedding invitation. I think this is one of the really remarkable things we achieved by microsurgery. But I'll also give an example. If we are not put back, I think unfortunately we didn't get the scalp of this girl not put back. If we are not put back, the effect is this. I think we see I think you really can't compare this to this. I think it's just not possible. But then you really have to think of persons who made this possible. I think this is made possible because of the technological advances. I think we always have to think we get a good microscope to see magnification, we see it comfortably. And the most important, devising of the instruments to handle small sutures. The needle is only about 70 microns. 70 microns means 1 millimeter is 1000 microns. 1 millimeter is 1000 microns. So 70 parts of a millimeter, of 1000 per millimeter is 170 micron. So that's the needle is so small, it must have a sharp end. It must not bend, it will be sturdy, and to that small end you need to attach a thread. So attaching a thread to the needle is the most important this thing which they were not able to do. And I think you really have to go through this video. I think this is unfortunately the sound doesn't come. This is what Ackland is speaking. So this is two people in Switzerland. So it's Werner Springer and Jean Trent. I think these are the two people, and they do a company which manufactures sutures. See, that's the needle. It needs to be placed in an instrument like this here, and exactly in the middle there must be another this thing which comes in and puts in. So that means it makes a hole into that. And to this the needle, the suture must go, and you must have another instrument to make this. I think that's the thing. So that means there must be somebody who is able to make the tool, and the tools to make the tools. I think they have to do. You have to have the tools, and you must have the tools to make the tools. You have to do it, and then that's the thing it is like it. And if you don't do it correctly, see, if you do it correctly, it comes up. There's a little bit of angulation, it comes like this. And when they close it, what would happen is it will break. I think the needle will not come through. The extent of mistake that can happen is 0.002 millimeters. 0.002 millimeters is the small, this thing that could happen. So that means these are the guys who really made it. I'm extremely grateful to this. He says, when I speak of these are the guys who are really heroes of minor surgery. So that means, and it also goes on to say how they made the sutures, how they made the needles out of steel wires and all this. Suppose if you really see them, sometimes we may even cry. But then if you ask yourself a question, who asked them to do it? So who asked them to do it and why should they do it? Why should they struggle so much to do it? I think what drives them to do it? I think that's a real question that we always have. And sometimes I used to think, what made Gandhiji think, we like it, Purna Swaraj? What made him do it? Why should he do it? They used to think, why the hell he should do it? But I think somehow I think those are the people who just drive the world. So I think that they practice excellence. I was extremely fortunate to be closely associated with Dr. Acklin. And at the time he has got a manual. And the manual was produced in the 1970s, the manual was produced. And when he was getting older, he was trying to find a fellow who will print it properly and then distribute it and make the next edition. So we are closely working on him for the close edition. This was me sitting with him and he telling me how to edit and how to do it. So it was a very magical experience, I should say. So one night, this is in Cleveland, in one of friends' houses where he also had come, and then we spent 2.5 days preparing the last edition. Normally when you retire to bed and the first time when you meet a person in the morning, what do you ask him? Bob, how was last night? Did you have a good night's sleep? I think I asked Naveen also asked me when he picked me up this morning, he said, did you sleep well last night? I think that's a standard question that we ask, and the standard answer that we expect is, I got a good sleep. That I don't know why we asked the question, and also why we answered the question. Okay? So I also asked him, Bob, did you have a good night's sleep? He said, no. Sir, I was in for a shock. Now why? He said it's because of you. Okay, I didn't have a good sleep. Not really, he said. Why I asked him is partly because of your comment. Because just before leaving, he asked me, do you think everything is okay? I was in passing, it didn't take too much into my head, but in passing I said, in that figure I think particularly was not very clear. Maybe if something is there, it would be much better. Some comment I gave him. But then he has taken it so much into his mind and said that after hearing your comment, I couldn't sleep. So I worked on it the whole night. Okay? And now I have remade it. Please see how it is now. It's just amazing. I think, it just has to see how is it amazing. And it was really good. So I think that's the thing which really drives excellence. I think those guys really do excellence. And when you think that you are doing something great, if you really compare with what they have done and their people have done before us, or what we make our life simple, I think it fails. I think it really fails. And you find in this our micro lab now, you see the book that is there, okay, which is there. And 31st of March 2025, I think just a few days ago, I was a visiting professor in Vanderbilt University in National United States. I went to the lab and then I was very pleasantly shocked to find the book there. And the book was there on the table and each of the guys who have been given the book, and a lot of the fellows are getting autographed. And the person who is the person in the middle who is holding is one of the legendary, he is the editor of the General Microsurgery, who was originally trained by the legendary Dr. Chen from China. So I think the excellence it survives. I think this book was made printed initially in 1977, and now we are in 2025. So that means if you do something excellent, I think excellence survives. And the excellence has got. I always keep telling my friends that excellence has no expiry date. Again, other things expire, but excellence has no expiry date. And if you have the firepower, if you have to practice excellence, I think what you really require is you need to have a lot of firepower. You need to have and somebody to really booster rockets to support you. I think usually it comes from the family. I think I should thank my parents for it, because my mother always said, even from very young, she said, small age is a crime. I think later on, years later, I think our former President Abdul Kalam also has said, almost the same words he used, small age is a crime. I think you have to aim for really big things. And the other thing is you can really aim for big things. Most of the time what really happens is people aim big things and try to achieve it in the wrong way. I think that again is wrong. I think the one thing which our father taught us was, I have seen it, I have never found him to do a thing if he thinks it's wrong. I think just even in the most trying and demanding of circumstances, I have found him to stay back. I used to tell my brother that it is extremely easy for us to be ethical. It's extremely easy for us to, because we have everything now. So it's extremely easy for us to be good. But then to be good when circumstances are very difficult, I think that requires a good spine. I think that requires a good spine. I think our father really taught us. So I think for those of you who are young, I think for practicing excellence, I think it's a pretty easy thing. And we also have a founders oration. I think our last founders oration was in December 24. And we had the chairman of the Dr.S, Mr. Chandrasekhar, gives the oration. So at the end of it, I think Chandrasekhar now, if you really see, he totally manages the company. He's got a net worth of $470 billion and with the annual turnover of $170 billion. So at the end of it, there is a small question and answer session. One young girl got up and said, do you think in the present circumstances we can achieve things if we really try hard? Do you think it's easy to achieve excellence in work we do? He stood for a little while and very calmly he said, aspiration is free. Okay? He said, used the word, aspiration is free. You can anything you want to aspire, you can aspire. And next he said, working hard is also free. Okay? That was not easy. He said, aspiration is free. Working hard is free. Provided you work in the right direction, I don't see any reason why you can't do it. So the whole hall, fell a little bit silent. And suddenly after a few seconds, everyone started clapping. I think only then we understood the magnitude of the words that they used. So I always repeatedly keep telling, aspiration is free, working hard is free. Okay? And provided right to work in the right direction, why not? What should be there to stop you? That is said. And I also have to thank my wife and my son and my daughter for making all this worthwhile. And once again, I should say that all of you, I think those of you young, those who are classic students, must read the note about Dr. Kishwani written by Dr. Anubala. I think it really makes a worthwhile reading and it justifies what Sunil said in the beginning, that we need to have a founders oration. And it's extremely important to recapitulate the ideas and the vision with which the founders built the institutions. Because individuals build institutions, but institutions now are immortalized by those individuals. So thank you very much, Sunil, for giving what.